I want to thank our council and our staff at the city, all the residents and businesses in Mississauga for their support through this crisis. Of course, we always thank our frontline workers, our emergency workers, the healthcare workers, the grocery store employees, our ATU union, the pharmacy employees, transport workers, and airport employees, everyone on the front lines. Thank you. We are all in this together. I'm joined here today by Dr. Lawrence Lowe, who is our Medical Officer of Health at the Region of Peel, Fire Chief Tim Beckett, the leader of our Emergency Operations Centre team, Gary Kent, our Commissioner of Corporate Services, and Mohammed Faki, President and CEO of Paramount Fine Foods, for a very special announcement. Just a little over 2 weeks ago, Mississauga declared a state of emergency to deal with COVID-19. For well over a month, we've been working to provide relief to our residents and businesses during these unprecedented times. We were among the first cities to provide financial relief by deferring property taxes and the water bill payment, offering free transit, and closing city buildings and park amenities like our playgrounds, our basketball courts, just to keep residents safe. Last weekend, we launched a blitz in our parks and our public spaces to enforce physical distancing because, unfortunately, many people were still not getting the message. The vast majority of residents are listening, but there are still some who are not. To them, I say, you're not only putting your own life at risk, but thousands of others. Your actions could result in a loved one, a parent, or a grandparent being sick or worse. Over the weekend and up to today, we had 30 enforcement officers out blitzing the hotspots right across our city. We always educate first and only issue fines if absolutely necessary. Officers stopped over 500 residents to educate them on physical distancing rules, and they turned back 500+ cars at our parks and issued 2 $750 tickets. The tickets were issued to 2 young men in their 20s at Iceland Skate Park who admitted to our officers they knew that the park was closed, but used it anyways. They also were not practicing safe social distancing. They left us with no choice other than to issue them $750 tickets each. We will continue to have boots on the ground to enforce these rules, so please don't risk a $750 ticket yourself. Our goal is to keep our residents safe, and the best way we can is to ask them to stay at home. The virus can only move to others if we move it. If we stop moving, it will die. So today I'm pleased to announce that Council is taking additional measures in the fight against COVID-19. Today, in fact, we had a virtual Council meeting where we took the following actions. First, we made the unfortunate decision to cancel all city-led events and third-party events at city facilities until July 3rd, including Canada Day. Even when life returns to normal, we will not be encouraging large gatherings like the 20,000 people plus we see on Canada Day. We also need to give certainty to all of those who are planning events in the community, and there are over 368 events scheduled between now and July 3rd right across our city. This is not a decision we take lightly, but we believe this is the right decision in these circumstances. We will provide account credits to organizers or refunds where requested. And we look to reschedule these wherever possible. Perhaps we'll celebrate Canada Day on Labor Day. I would call on the Premier and the Prime Minister to provide some certainty around this as well. Secondly, today we also waived late fees for all pet license and mobile license renewals such as taxis, retroactive to March 1st. Until such time as our service counters reopen. This was done to alleviate the burden on pet owners, many of whom may be struggling right now to make ends meet. It was also done to reduce the burden on our taxi industry and public vehicle drivers who are being impacted by this crisis. We're trying to remove another worry from people's minds. Third, we are announcing today the closure of Korea Park during cherry blossom season. Again, this is not an easy decision to make, but it is the right one. It is my hope that the residents will be able to admire the beauty from a distance. We anticipate the trees will blossom towards the end of April, and we will monitoring more closely with the warmer weather, and we will keep you all updated. 4, we also deferred the remittance of the municipal accommodation, the MAT, to the city for 3 months. This was a request of the hotel industry, and when we spoke with them last month. It will provide some relief and allow some cash flow to get through these tough times. And 5th, today we also voted to allow all groups that receive grant funding from the City of Mississauga to retain their grant funding for 2020 as long as it is used for the purposes it was requested for. Any remaining funds will be applied against the 2021 grant. Council also received a report today from our finance team outlining what the financial landscape looks like in the coming months ahead. Like all Canadian municipalities, Mississauga will be facing a significant deficit, which could top $100 million, depending on how long distancing measures are in place. We know that to the end of June, we'll have a $60 million deficit, and this puts us in a very tight spot financially. We'll have to make some very tough decisions moving forward. The reality is, unlike the feds or the province, municipalities are not legally permitted to run deficits. We get 60% of our funding from the property tax. The other money comes from revenues from our transit and recreation. And transit, of course, is reduced right now, and recreational facilities are closed. My message is clear. Cities do not have the revenue tools or the fiscal firepower to get through this on our own. I'm calling on both the federal and provincial governments to help us weather this storm by providing relief for municipalities in the coming months. Both the federal and the Ontario government have done tremendous work to date to respond to the pandemic, and I really want to thank them for their efforts. I've spoken to hundreds of residents, businesses, and community organizations. They are behind us, and they will work with us as we move forward towards recovery. Much of that planning is already underway. I'm going to pause here to invite my friend. He's president and CEO of Paramount Fine Foods. He's a community philanthropist and all-around outstanding guy, Mohammed Fiki, to join me here at the podium. I'll move away. We know that many people are struggling to make ends meet and relying on food banks now more than ever to feed their families. Stockpiling is not an option. Emergency situations like these put additional stress on their already tight budgets. Our local food bank, the Mississauga Food Bank, needs help raising $840,000. I'll say it again. They need help raising $840,000 to keep their shelves stocked during this crisis. That's $360,000 more than usual at this time of year. They need the love and the support of our community now more than ever. Mohammed is known throughout Mississauga and across Canada for his kindness and generosity. He is dedicated to making our city, his home city, a better place and ensuring that no one gets left behind. So I want to invite Mohammed to join me to make a very special announcement. Please, Mohammed Fiki, CEO of Paramount Fine Foods.
Good afternoon, everyone. Ladies and gentlemen, I'm here today for a very important reason. I'm here to tell the people of Mississauga, you are needed. Our food bank is running low on supplies. For those of us who are able, it's time to open our hearts, open our wallets, and help. We all know that this is a time of a greater challenge. So much about our daily lives has changed. For some of us, it's an inconvenience, but for others, it's a crisis. Today, there are more people in our city who have lost their jobs or their businesses. There are more people in need. There are more who rely on the food bank, and the food bank relies on us, the people of Mississauga. Because of the virus, the food bank cannot hold its regular fundraising events. It cannot accept food donations in many of the usual ways. It is in dire need of our support. There is one way for us all to help, and that way is by donating. If we have the means, we need to dig deep and give. We need to donate now, immediately, and generously. We need to raise at least $800,000. I know it sounds ambitious, but that's what we need to make sure that our fellow citizens get the healthy food they need for themselves and for their children. In partnership with Mayor Bonnie Crombie, I want to do my part to get things started. Just before I came up here, I sent out a tweet about this urgent fundraising campaign. It's not any fundraising campaign. It's an urgent one. For every retweet, I will donate $1 to the Mississauga Food Bank, up to a total of $10,000 to start this thing, to start it going for everyone. I encourage others in our community to issue the same kind of challenge. Most of all, I encourage everyone who's comfortable today to think of those who are not, and then give. So please join me and support this campaign by donating to the Mississauga Food Bank and go to their website, themississaugafoodbank.org. The food bank is a lifeline for thousands. Let's make sure it is ready and able to help those who are in need. We learned a lot about ourselves and our community in a time of a challenge. Let's make sure that history says of us, in dark moments, they showed the light of a generosity. Thank you.
From the bottom of my heart, Mohammed, I thank you on behalf of the residents of Mississauga. I'm now going to turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on the Peel Region's response to the pandemic. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon, everyone. With community transmission established in the region of Peel, our cases continue to rise steadily. As of this morning, we have 684 confirmed cases of COVID-19 in the region of Peel. 378 of those are residents of Mississauga, 270 are residents of Brampton, and 33 are in Caledon, with 3 pending further information. Our healthcare picture at this time is also starting to see more severity, which is also expected. We are beginning to see more cases present in our area hospitals, including some who require ventilatory support. We also grieve with families in the region that have lost their loved ones to COVID-19, regrettably 9 as of this morning. I want to stress that these trends are expected and will likely continue over the coming week. I also want to state my gratitude for our first responders, my wider healthcare family, and our essential service and retail workers, and join them in asking everyone for one simple thing: stay home. Stay home for yourselves, for your loved ones, and for those who must leave home in order to keep our country turning. If we continue to stay home and not let up, I am certain that the coming weeks will allow us to see the fruits of our sacrifices. But we cannot stop now. We must remember that viruses spread by adapting to human behavior. COVID-19 preys on the one thing that most of us cherish: our relationships, our time spent together in person, our social nature. And it is for this reason that we must reduce our in-person interactions. And so I encourage all of you to do your part to keep our frontline workers and our community safe. For our part, Peel Public Health will continue to respond. We will continue to answer your questions on social media, our website at peelregion.ca/coronavirus, and our call center lines at 905-799-7700, 7 days a week from 8:30 a.m. till 10 p.m. We will continue to aggressively follow up on every case and contact and investigate every outbreak to break chains of transmission, protect others from spread, and save lives. And we will continue to coordinate with community partners to put in place measures for physical distancing that will help protect our most vulnerable from the ravages of this disease. But we need you to do your part, now more than ever. If you are sick or returning from Canada, federal and local orders are in force. Self-isolate in your home for 14 days or risk enforcement and fines. If you are well, please stay at home and only emerge for the most essential needs. Groceries once a week, medicine or health care as needed, and exercise on your own, with a pet, or a partner from your same household. This advice is particularly important for seniors over the age of 70 and those with pre-existing medical conditions. Maintain physical distancing of 2 meters from others while you are out and about. And if you are in an area where physical distancing is not possible, a non-medical mask may help to slow spread. It does so not by protecting you, but by protecting others from your own germs if you are brewing a COVID-19 infection. If your business has been asked to close, if you have not been directed to use playgrounds or parks, if you have been asked to not host large gatherings, please respect this. No one wants a fine, and no one wants to see our first responder partners and bylaw officers put their own health in harm's way in order to protect yours. And even if your work has been deemed essential, I urge you to protect your employees and public by putting measures in place to promote physical distancing. Limit service to pickup or delivery, and if you cannot, limit occupancy or hours of operation to reduce crowding. And if you are able, consider closing anyway. Given everything that is happening, there has never been a better time to stay home and spend time with your family and loved ones. Finally, with spring holidays and lovely weather coming, remember that the best way to show your love and care in celebrating during these unusual times is, in fact, to stay apart. Celebrate virtually with family and friends, and if you must spend time outdoors and enjoy it, try to do so alone. I urge you to be the difference, to flatten curve and save lives. Stay home, stay safe, limit person-to-person spread, stay apart physically, but together in spirit. Thank you. I'll pass it back to the Mayor.
Thank you so much, Dr. Lowe. It's Passover today, Hag Sameach, and Easter this weekend. I want you to know if you're going to gather with your families to celebrate, as Dr. Lowe has said, please, your most immediate families, no extended families this weekend. Please don't. I'm asking you all to stay in your own homes. Tune in to Sunday services online, Sunday Easter services online, Zoom, FaceTime, Skype, whatever you like with your family members. They're all eager, as we all are, to get our lives back to normal. And the only way we can do that is sticking this out and listening to the advice of our health professionals like Dr. Lowe and Eileen Davila, and to the kiddos tuning in. Don't worry, the Easter Bunny has been designated as an essential service, and he will be coming this weekend. So before I close, I just want to reiterate that if residents wish to wear a mask, they most certainly can do so, but please leave the medical grade masks for our frontline workers. Make your own mask at home. I also ask that if you can, please donate to Trillium Hospital, to their PPE drive at trilliumgiving.ca/PPE. Lives are at stake. And you just heard Mohamed Feki issue a challenge to help us fund the food bank as well, and he will match every donation, every tweet for $1. Our frontline workers need our help to stay safe and stay healthy on the jobs so that they can care for loved ones. Finally, residents are invited to join our second citywide teletown hall this evening at 7 p.m. and Dr. Lowe will be joining us as well. Details can be found on the Mississauga.ca website. 2 weeks ago, over 24,000 people joined us. So I hope you will join us as well. We look forward to answering your questions in the interim. Please stay healthy, stay safe, stay apart, stay home. And now I will open the floor to questions from the media, and I will, Dr. Lowe is happy to respond, Mohamed Feki. I also have Chief Tim Beckett, our fire chief, with us, and our Commissioner of Corporate Services, Gary Kent. Are there any questions?
Mayor Crombie, your first question comes from Steve Cornwall at the Mississauga News. Steve?
Welcome, Steve. Welcome, Steve.
This is a question for Mayor Crombie. I'm Mayor Crombie. Just wanted to ask, I guess today there was a slight increase, or a slight decrease in the increase, of cases in Mississauga and Peel. I'm just wondering, if, kind of reflecting on this a bit more than a month into this kind of pandemic saga. Is there anything that you wish you had done earlier at this point that you kind of regret not moving on faster?
You know, we always take the advice from our public health professionals, Steve, and we implemented at their advice as soon as we could. We shut down not only the schools, but our camp programs, our recreational facilities, our libraries, our community centers, our arenas. We closed the parking lots to our parks. When we saw residents gathering around the facilities, including the playgrounds, the basketball courts, the soccer fields, the skate parks, we closed those as well, and asking people to really respect physical distancing of 6 feet or 2 meters, to continue to wash their hands, don't touch your face, and use hand sanitizer. We all want to get through this. We want to stop the spread of this virus, and we want to get life to normal as soon as possible. So, Steve, we've implemented as soon as possible every recommendation from our medical health officers that they offered.
And just to follow up on that, I just noticed that there's a slight difference in style between yourself and Mayor Patrick Brown in Brampton in terms of kind of naming and shaming folks that have been kind of caught up in getting tickets and fines publicly. Is that something we can expect in the future, to provide more details publicly on who's kind of still out there, still kind of not respecting these physical distancing measures?
Oh, with respect to naming individuals, I have no qualms letting people know which businesses, which individuals have broken the rules, and those are the folks that are acting irresponsibly, selfishly, and I will say, and very unsafely, and they're putting other lives at risk. They're putting in jeopardy individuals who have compromised immune systems, pregnant women, seniors, the elderly. I'm particularly worried about my 84-year-old mother who is in lockdown in her own condominium and won't even let me come visit. So let's hope that folks out there are very worried about their loved ones, particularly their parents and their grandparents and everyone else in our community who could be threatened if they actually contract this virus.
Thank you, Steve. Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead and ask your question.
Hi, Isaac.
Hi, Mayor Crombie.
Hello.
My first question is similar to Steve's, and I'm asking a little bit with a comparison to Brampton. Patrick Brown's been quite active using his emergency powers, and you have been less proactive in them, using more council decisions. Could you explain to me a little bit why you've taken that approach, and in what situation you would use your emergency powers?
Isaac, it's a great question. It just speaks to the different styles that Mayor Brown and myself have. He has his press conferences on Tuesdays. I have council meetings on Wednesdays. I'm very collaborative with my councillors. I consult with them regularly. I consult with Mayor Hazel McCallion regularly. I consult with our public officer of health. I'm on the emergency team policy meeting calls at 8:30 in the morning and the regional public health calls in the afternoon. And during the day, I'm consulting with stakeholders, whether they are our business stakeholder group, our seniors, all of our seniors organizations. We had a call with the Muslim Council of Peel yesterday. We've met with our Economic Development Advisory Committee and our tourism panel. So I will say that I have a style and a different approach than Mayor Brown. Even notwithstanding, we're under emergency declaration orders here as well. I prefer to really collaborate with my council members and confer with them whenever I can, and rather than having a press conference on a Tuesday, I prefer to have a council meeting on Wednesday and have this press conference or video update following that each day. And we're very collaborative in our council, and we're very cooperative, and we're all working in the best interest of our city to stop the spread of this virus. And I think it's very important that their opinions are taken into consideration. They have their ear to the ground with all their residents, and they provide that feedback back to me.
Thank you. And my follow-up is for you and possibly Gary Kent as well, just based on the report which was received at council today in terms of the finances. I want to know if this has any impact on things like the Ontario LRT, the Dundas BRT, or projects like the Oxford Properties Square One district going forward after the crisis.
And just to respond as well to your last question, should I use my emergency powers? If a decision needed to be made quickly, I certainly would. But if I had the opportunity to consult with some of my council members and my team, I certainly would do that. With respect to the building of some of our transit projects, the LRT we are moving forward with. As you know, residential construction has been put on hold other than if it's near completion. And Gary, I don't know if you want to, I can step aside if you make some comments on the report that you issued today that suggested we could be $52 million in deficit by June should this continue. Over to you, Gary.
Well, thank you, Madam Mayor. Just adjust this properly. Oops. I did have a cloth somewhere. There you go. There you go. So, Isaac, I think your question was relating to construction. So I think the Mayor covered it off. Basically, we have to, we've closed our own construction apart from transportation. And the most significant project probably is Churchill Meadows, which is in the West End. So we've got good contractors. They've been communicating very effectively. What I spoke to Council today was not just the impact of COVID this year, but in future years. Of course, we don't know how quickly it rebounds. And in case of construction, for example, there may be some legal claims around delays. And there's some delayed revenues that will echo for years to come. So a lot more information to gather, and the numbers that we did share today will definitely change. We're just not sure if they'll go up or down, and that will depend on the decisions and the direction from Peel Health and the medical experts as to how we have to behave going forward. Thank you.
Thank you. Mayor Crombie, your next question comes from Ashley Newport at Saga.
In Saga.
Please go ahead. In Saga. Ashley, please go ahead.
Oh, hi. So my question is actually for Dr. Lowe, if he's available
Certainly
to take
he is.
it.
We'll bring him forward. Thank you, Ashley.
Okay, perfect. So
And Ashley,
let me know when
Ashley, it's Mayor Crombie. You could tell Khaled I still haven't watched Tiger King.
I will tell him.
Hi, Ashley.
Hi, how are you?
Doing well, thanks. Go ahead with your question.
So I know that there's been a lot of reports over the last 2 days about how testing rates are a little bit lower than they should be in Ontario. So I was wondering, do you think that we're doing as much testing for COVID-19 in Peel as we should be doing? And do you know how many people Peel Public Health is testing per day? And is there capacity with Peel Public Health to potentially test more people? And is there still rigorous criteria around who can be tested, or can anyone with symptoms be tested if they're referred?
So Peel Public Health adheres to the provincial guidance on testing, and so my understanding is that they're in the midst of reviewing and coming up with a provincial testing strategy around COVID-19. In respect of the number of tests that are done in Peel, we have all the different assessment centres, both in Mississauga and in Brampton, that are doing lots of tests every day. I don't have a specific number because that's all tracked at the central level at the Public Health Ontario laboratory in terms of the number of tests that are available, that are done, and those numbers are certainly available online as to the number of tests that are being done across the province.
Oh, okay. And about who can get tested right now at this time?
So at this time, the criteria that I understand at certain assessment centres really focus on the high-risk populations and the ones that serve them. So they are looking at people who are symptomatic and also are above the age of 60 or with a medical condition that might predispose them to a more severe outcome with COVID-19, and also certainly our frontline workers, healthcare workers and first responders are also being prioritized. That said, I mean, I do understand that the province has brought additional testing capacity online, and I know that a provincial testing strategy is being developed, and I imagine we're going to see broader testing in the weeks to come to ensure that we are fully ahead of this virus.
Thank you. Madam Mayor, your next question comes from Shady from Media in Toronto. Shady, go ahead and ask your question.
Yeah, hello, Mayor Crombie, thank you. My question is that there is an increasing number of calls regarding calling international and foreign doctors to join the fight against COVID-19. how is the possibility of this cause to be applied here in Mississauga?
Well, certainly, and I may ask Dr. Lowe to respond to this as well, but I think it's the College of Surgeons and Physicians that has to approve all new doctors, licensed doctors in the province, and I would hope that many are in the process of doing so. I know that many medical students have been co-opted so that they too can assist in our efforts, whether it's analyzing test results or assisting in hospitals. And why don't I pass it off to Dr. Lowe as well to see how else our foreign-trained doctors can participate in the system. Thank you, Dr. Lowe.
Thank you.
Thank you, Madam Mayor, and thank you for the question. This is actually an area that we are actively looking at Peel Public Health, and I also know is being actively discussed at the provincial level. Public Health Ontario just recently issued a notice that they are putting together volunteer services that can assist public health units, both in terms of case and contact management as well as administrative tasks around provincial databases and entry. I imagine that as the response to COVID-19 progresses, the need for additional supports will grow, and I really do think a centralized all-of-province approach is probably the best way to ensure that skilled volunteers such as international medical graduates are appropriately onboarded and brought in to support the response. Thank you.
Thank you.
Shady, do you have a follow-up question?
Yes, no, thank you. Thank you.
Shady?
Thank you.
Thank you.
Madam Mayor, next question comes from Jay from Modern Mississauga. Unfortunately, he's not able to join the audio, so I'm going to read the questions on his behalf. There are two.
Certainly.
The first question is, the surge in COVID-19 cases is close at hand. Will there be weekend-only blitzes similar to last weekend, or will there be a daily presence of Mississauga security officers at parks in the near future?
Thanks for the question, Jay, and I think the answer to that is yes to both. We will entertain future blitzes, but you will see the steady and very visible actions of our bylaw officers who will be out in the community in full force. We've encouraged all residents, if they see any infractions of groups over more than 5 people gathering or people using our amenities, our playgrounds and facilities, to call 311, just as you do in Toronto or in Brampton, call 311, and that will activate our bylaw enforcement, and they'll be ready on the scene. But this weekend and next, you will certainly see a bylaw enforcement presence in our communities, and there may be, if this continues, if COVID-19 continues, you will see other blitzes as well. Thank you for the question, Jay.
And the follow-up question, should residents with family members in seniors' homes or long-term care facilities be moved out of those facilities as a precaution, given the tragic high number of deaths at Pinecrest Nursing Home in Bobcaygeon?
Yes, certainly. So we want to ensure that our seniors, our beloved grandparents, have the best possible care. And I think I'll defer to Dr. Lowe because I know that he has some protocol and policy on this issue. Thank you.
Thanks so much for the question, Jay. I mean, I certainly would reiterate the importance of protecting our senior population and those folks over the age of 70, regardless of whether they're in a long-term care facility or out and about in the community. Really, that population segment deserves our attention at this point in time. In terms of the long-term care question around moving out of long-term care homes, we do recognize that it is a personal choice, but for the most part, those who are in long-term care typically are there because it is the place where they can get the daily care that they need. We have taken, and I know both the Region of Peel's own long-term care homes as well as long-term care homes elsewhere in the region have taken significant steps to reduce the risk of COVID-19 from being brought into these homes. I think the best way for any family to do this would be to have a detailed, careful decision with the administrators at the home to figure out what would work best for their individual residents. If they are taken home, if residents are taken home, it is important to remember and try to figure out how family and loved ones can continue to meet for the daily needs that are currently being met for these residents in long-term care homes. And it is also important to remember that leaving a long-term care home may result in the loss of the bed which the resident is actually occupying. And while there may be some readmission priority when they come back, there could be a delay in getting back into the home later on. So certainly weighing all those factors would be important around any decision taken on that matter. Thank you for the question.
Mayor Crombie, your next question comes from Joe Warmington from the Toronto Sun. Joe, please go ahead and ask your question.
Welcome, Joe.
Can you hear me now?
I can hear you, Joe. Thank you. Thank you for following.
Okay, yeah, thank you. I wasn't sure how to do this. Again, thank you to everybody for all your efforts. I guess the one question that, I'll just narrow it down to one question because a lot of them have been answered in my note that I sent. And that is that a lot of people in their homes have essential workers. They also have medical workers, PSWs, et cetera. And maybe the doctor and also the mayor could address it. You know, you get the concern. I mean, people are going to work, they're coming home, and their families are terrified. And people are going a little bit crazy because they're cleaning everything, but, you know, this invisible bug that can get you, you know, it's creating a real problem.
You know, Joe, it's an excellent question, and we have heard those concerns, and I will also ask Dr. Loh to address them. And I want to thank you for your article today, because I think it's very important that people realize that we will be enforcing, and while we're educating people, if people don't agree and don't cooperate, we'll fine them, and we have every intention to. So with respect to people who live with essential workers, we advise them to take the utmost precautions, keep their distance, obviously, and I'll ask Dr. Loh to further comment, because I think he'll know all the things they should and shouldn't be doing.
Thank you very much for the question, Joe. I should state at the outset that this is very much a situation that I am living. You know, my wife is a family doctor, and so she is on the front lines, and this is something that we often have conversations about on a regular basis, both of us essentially being essential to this response, as it were. The guidance is pretty clear at this point in time that people should be taking every precaution they can when they return home, trying to limit the potential spread or transmission of this infection. People should be self-monitoring, making sure that they're identifying any new symptoms, new cough, new fever, even anything that seems out of the ordinary. And then certainly if they develop symptoms, it's a matter of making sure that they're following effective self-isolation protocol, trying to stay in a separate room, wearing a mask when they're in close quarters with their partners, et cetera. We do also know that in learnings from other jurisdictions, that household transmission is certainly something of concern, and it is something that we are actively looking at Peel Public Health, looking at questions of temporary accommodations for workers, et cetera, both to slow spread and also to bring maybe a bit of a measure of peace to the minds of these individuals. But at this time, we don't have any other specific recommendations other than just making sure that people self-monitor for symptoms and certainly aim to self-isolate if they do develop any symptoms. There is guidance available on provincial websites. Public Health Ontario have a great resource around how to self-isolate effectively, and that's where I would probably begin, you know, just at least in reassuring other people in my wider healthcare families around how they can take care of themselves and their loved ones during this difficult time.
Thank you. Just one quick follow-up for Mayor Crombie, if I may.
Thank you, Joe.
A question about the food banks, and hats off to Mohammed for
what
he always does for Mississauga and for everywhere. But what I'm worried about, and it's something new I hadn't heard before, is that the $800,000 obviously is a crisis of families that we don't see that are in need of food. And the question is there some way to get the food to them quicker than maybe do the fundraiser to catch up to it later? Is there something the federal or provincial governments can do to give you emergency money, make sure nobody goes hungry here?
I think those federal and provincial programs are in place, Joe, and the Prime Minister suggested that, you know, there are many programs, whether it's EI or the CERB, the Canadian Emergency Response Benefit, are all in place, providing up to $2,000 for those who are self-employed per month. So there is financial assistance for and business continuity funding as well, so people can get through this time, and many others will be reaching out because this is a crisis for them. them if they've been laid off and aren't eligible, or it doesn't go far enough to be using their food bank. So we really ask everyone to open their hearts, open their wallets in this time. This is a crisis for many people, and we see the numbers are staggering of people who are using our food banks. So this is not business as usual for our food banks. This is a crisis situation. And so we ask people to be generous, like Mohammed Faki, and step up and dig deep and do whatever they can to support their friends, family, and neighbors.
Thank you.
Mohammed, would you like to make a comment? Oh, Joe, Mohammed Faki would like to make a comment as well.
Okay, yes, please.
Thank you so much, and I really appreciate the question. So we've been in touch with the food bank for days, and we were waiting for the federal government initiative. But what it's needed today, $840,000, is actually after all the help that they were able to receive from all the programs. So I'm not only rallying individuals, anyone is welcome to donate, but the money is needed now. Unfortunately, more I speak to them, more I felt the need of launching something that maybe we take in our hands, and hopefully other level of government will help. They've done a great job so far. I thank them for that. But the Mississauga Food Bank do need $840,000 now, and we really need to help them. There is no other reason for us to do this unless we have checked with every level of government initiatives. Thank you.
Joe, just to Joe Warmington, it's Mayor Crombie again. Just as Mohammed has said, and it's an excellent line, he said, for some people this is an inconvenience for a few weeks, but for others this is a personal crisis, and those are the people that we really need to step up and help. Okay. Last question, I think. Thank you, Joe.
Mayor Crombie, your last question comes from Dave Wojcik from the Mississauga Board of Trade. Dave, please go ahead.
Thank you, Nicole. My question is for Dr. Lowe. I know the mayor and the Board of Trade are very proud of a lot of the companies that are stepping forward and engaging in this fight against COVID. We have Microbix that developed the controls for the testing for COVID. Baylis Medical is now manufacturing ventilators. But we also have companies that are also donating PPEs, such as Electra with N95 masks and MHI with gloves and visor frames. As we get these inquiries or for companies that do have these supplies available, should they be contacting someone at the Region Appeal Health, or is there a central location that they can contact and let somebody know that they have these supplies available?
I actually think this is a great question for Mayor Crombie, because I know that she's really taken this one on. So.
I have that information, Dave, as a matter of fact, because for a little while there was the central repository of people who wanted to purchase PPE or wanted to sell PPE, including ventilators. And so I will share with you that anyone looking for PPE, including our LTCs, our long-term care facilities, should contact Debbie.Roberts at the LHINS, LHINS.ontario.ca, and I have a phone number. And David, I'll get all this information to you. And if you're looking to sell PPE, that's a whole other different individual, monica.hall@thp.ca. And if you're looking to donate PPE, they're taking it at trilliumgiving.ca to our Trillium Health partners. So Dave, I can send all that information over to you. Those are people at the LHINS that have been designated as the point person so that we can regionally organize and distribute PPE as it's needed. So the facilities which have the greatest need will receive PPE first. It's done on ethical measures first, right?
Thank you, Mayor. That information we greatly appreciate it.
I'll send that over to you.
We're getting inquiries about that. My next question is with respect to the deficit or the proposed deficit that was raised at Council. We know that certainly the pressure will remain on the federal and provincial governments to backstop any deficits that are incurred by the city. And we know that it takes a change in the act for the city to even contemplate running a deficit. And my question is, is that on the table? What discussions have been had about the city actually being able and having the funds or having the ability to run a deficit? Is that a discussion that is being had?
So certainly it is being had at many tables. In fact, the big city mayors have that concern right across the country. There are 23 of us. We meet about once a week by conference call. Secondly, the large urban mayors of Ontario are also deeply concerned about every municipality that will be in a deficit position, which is illegal for us, by the way, for folks who don't understand. The federal and the provincial government can run deficits. Municipalities are not permitted to do so. And 60% of our revenue does come from property taxes, as I mentioned earlier. So we did discuss that possibility at our council meeting today. We're, of course, asking the feds and the province to step up and assist cities during this very difficult time. I mean, these are extraordinary times, unprecedented times, so they require extraordinary measures. So perhaps different legislation may have to be passed. I mean, if it came down to us acting on our own, which I hope it wouldn't, certainly we would discuss perhaps implementing a different levy, looking at reserves. There are a lot of different things. Deferring projects, delaying projects, canceling projects. There are many different initiatives, and we'll have to look through our budgets line item by line item to see what can be done, and we will take whatever steps are needed to get to where we need to go. Gary, do you want to add anything? As this is his bailiwick, I should give him the chance.
Oh, thank you. I won't repeat what Mayor Crombie said. Thanks, David, for the question. I just want to reassure citizens that we're not having any knee-jerk reaction. It's very early days in terms of your own personal life, in terms of your own business situation, and it's very early days in terms of the corporation of the City of Mississauga. But there was a broad range of some ideas, and staff will be doing more work and coming back to council with some recommendations. One question we often get, Madam Mayor, is can you not borrow for the deficit? And you can't. That's illegal in Ontario, so you cannot borrow to fund the deficit, so that's not an option for us. However, Council today received some principles that we will use to help us manage and to guide us and to guide Council as they make decisions through these next few months. I'm very proud that the first one is that public health is the first priority, and that's the umbrella, and that's the signal that we'll follow as we go through together these next few months. I think I'll leave it at that. There's a lot of discussion across Canada with all the CFOs and mayors and members of council and throughout the province as well. I can tell you the federal government and the provincial government are listening. They're asking the right questions. They, like us, just need a little bit of time to come up with all the solutions. Thank you.
Mayor Crombie, we have one last question. It comes from Melissa McAvoy at City News. Melissa, please go ahead.
Hi, Mayor Crombie. You made mention earlier that after July 3rd, when life gets back to normal, we won't see large crowds at events. I was just wondering if you can elaborate a little bit on that. Does that mean you'll be limiting crowds after July 3rd, and by how much?
So not necessarily is the easy answer. We're going to monitor things day to day, week to week, and the guidance is right now is that we have canceled all events till the end of June, and we thought, wow, if you're only allowing up to 5 people to gather June 30th, how can you expect that 20,000 people could come together on July 1st? So just to be safe, we've canceled events to July 3rd in anticipation that others would want to gather. But whether or not we continue to cancel events and festivals going into the balance of July and August and September, that we'll wait to see. It depends on how quickly we peak, the virus peaks, and we come down the other side. And you can see other jurisdictions, certainly I think it was Denmark, Austria, a few nations. So even in Wuhan, China, in fact, they're starting to lift travel restrictions and other guidelines that have been put in place because they're now seeing no new cases of infection of the virus. And we hope to get there very soon, too. And if everyone follows the guidelines of public health officials, keeps their distance 6 feet, 2 meters, wash their hands, don't touch their face, use hand sanitizer, and stays home, we'll get there sooner.
Okay, thank you.
Thank you.
This concludes today's press conference. On behalf of Mayor Crombie, I want to thank everyone for participating. We'll keep you updated on future press opportunities. Our media team will be in touch shortly to share a link to the video of the press conference. Have a great day and stay well. Thank you, everyone.
Thank you all for joining us. Thank you.